We have a mental health crisis on our hands right now, and our children are paying the price. Adding his voice to the growing number of experts sounding the alarm, the U.S. Surgeon General says our kids are in crisis.
He is quoting data that shows the national average of weekly emergency room visits for suspected suicide attempts among teenagers jumped nearly 40% earlier this year. Even before the pandemic, rates of depression, anxiety, and mental health problems among kids in Maine were on the rise. As News Center Maine's Vivian Lee reports, calls are now getting louder for swift action to keep our most vulnerable kids from falling through the cracks of a system under even more stress.
It's being called a mental health emergency.
Every day at Maine Health, a third to half of our emergency department beds are filled with behavioral health patients. That is a real challenge.
Katie Harris is the Chief Government Affairs Officer for Maine Health. The state's largest healthcare system oversees 10 hospital emergency departments, a growing demand for mental health care amid a severe shortage of trained professionals is overwhelming limited services and creating bottlenecks.
And we're seeing patients getting stuck.
Already on the rise before the pandemic began, the Centers for Disease Control says symptoms of depression and anxiety have doubled during COVID-19. Including a 25% spike among kids and teens. The CDC also says emergency room visits for suspected suicide attempts increased by 31% among 12 to 17-year-olds in 2020 compared to the year before. Because of Maine's chronic shortage of pediatric mental health beds and services, often kids who experience a mental health crisis, the only immediate option is a local emergency room, a landing place where staff is often not trained or equipped to deal with patients with serious mental health needs. One parent says being in the ER was more than overwhelming for her son.
It was terrifying, and it was traumatic for him because he's hearing these adults who are under the influence of drugs or alcohol.
We are concealing this mom's identity to protect her son. The 8th grader has bipolar and mood disorder and is on the autism spectrum. Between the ages of 7 and 13, he has spent more than 100 days waiting in the emergency room after serious mental health episodes. Earlier this year, while living at a residential facility in Skowhegan, he ended up in the ER at Reddington Fairview General Hospital for nearly a month. His mom says discharging him was not an option.
I'm not going to allow him to come home and kill himself.
Every time her son got stuck in the ER, a state crisis team tried to find a bed in one of 4 hospitals in Maine that provide psychiatric treatment for kids 18 and younger. With only 110 to 120 pediatric mental health beds in the entire state, these facilities are grappling with growing waiting lists of kids in crisis. When he was able to get a placement, her son would improve enough to come home until the next crisis cycled him back into the ER.
These kids are being forgotten in the ER. They're there just wasting away and deteriorating.
Have access to care.
Finding solutions to try to fix what many call a broken mental health care system was the focus of a recent mental health summit. Diane Buffard has children in the adult behavioral system. She oversees a network helping to support parents of children with mental health issues.
This is the first time I don't feel I can give families hope because their services are not available.
That wait time, it is their lifetime because they're at such an acute state that they have no support.
Many kids and teens are languishing on wait lists for residential treatment programs that can't retain staff who are leaving for higher paying jobs outside of healthcare.
They are constantly dealing with high turnover of staff because staff don't want to stay in those jobs that don't pay a living wage.
Representative Lori Gramlich helped co-sponsor a bill that is expected to be taken up by the legislature's Appropriations Committee in January. It would increase the Maine Care reimbursement rate by 25% for prevention-based community programs, a much-needed boost to recruit staff to provide mental health services kids can access while living at home.
We cannot get workers to work in these facilities because providers have not seen an increase in their rates in decades.
DHHS spokesperson Jackie Farwell tells News Center Maine the COVID-19 pandemic and related circumstances have continued to present unprecedented challenges to all areas of the children's behavioral health care system, as well as the healthcare system as a whole. Providers have reported challenges with hiring and recruitment of staff. Meanwhile, some lawmakers say the system needs to be rebuilt from the ground up, a process that could take years of coordination and resources. Senator Kathy Breen is the chairwoman of the legislature's Appropriations Committee. She's also the mom of a daughter in the adult behavioral health care system.
We need all hands on deck, and we need to be very creative.
But for this mom, long-term solutions won't fix what is happening now, not only for her son, but for hundreds of other kids across the state.
And it's not okay. They're being overlooked.
In Wyndham, Vivian Lee, News Center, Maine.
And we have much more information on helplines, resources, and programs if you or a loved one is in crisis on our website and our News Center Maine app.